All right, everyone, we are getting ready to get started here. Welcome to another webinar with eAssist Dental Solutions. We are really excited for today's webinar. In addition to the 3 talented, wonderful dentists we already have on our panel every week, we have 2 additional dentists joining us today. Dr. Jenkins, who has been a client of eAssist for 10 years. And we also have Dr. Charles Blair, who's an industry leader in coding. And we are excited to have both of you guys here. And of course, we have Taylor Anderson as well, who's our attorney who keeps us all out of trouble. So with that being said, a couple housekeeping rules. We do have a Q&A section at the bottom of your screen. We will do Q&A throughout the webinar, so go ahead and drop any questions you have in there and we will get to as many as possible. On top of that, we will make sure that all the webinar slides and the recording and any resources we link to in the slides, we'll make sure to email to all of you guys immediately after the webinar as soon as we can get that taken care of for you. And in the meantime, if you guys have any other questions at all, you can drop them into the chat, drop them into the Q&A. And with that said, I'll let you take it away, Dr. A.
Thanks a lot, Sarah. Appreciate it. Thanks for joining, everyone. We hope that this hour you spend with us will be beneficial. I know during this crisis, we've had all types of emotions and highs and lows. I do see light at the end of the tunnel. I know the state of Utah just changed some rules so that we could actually open and do some dentistry, some more essential dentistry. And so we'll talk some more about state rules today, what's allowed in various states, what the ADA is allowing, what government agencies are allowing, so you understand exactly how this is a dynamic, this is changing, and you understand how it affects you. We also want to make it very clear that you're not shut down unless you want to be. Most states every state allows for emergency care, many states allow for urgent care, and more states now are allowing for all dental procedures. So we're going to be talking about that and helping you guide your own decisions and helping your patients and succeeding as a practice. We'll also talk about best practices for marketing that we've discovered during this crisis. There's a couple things we have to combat. We want to make sure we overcome those things. We want to also talk about teledentistry and how you can use that to fill up your schedule with emergencies and urgent care. We also hope that by the time you're done, you'll create a thoughtful action plan and implement it today. My name is James Anderson. I'm a dentist. I the CEO of eAssist Dental Solutions. You can see my credentials there. I built 9 dental offices. I'm an associate professor at the Roseman Dental School MBA program, also co-chair of their dental MBA board. And you can see where my education there. Taylor, tell us more about yourself.
You bet. Happy to be participating today. I'm a business lawyer with 16 plus years experience. I graduated with a JD and an MBA from Willamette University and joined eAssist a little over a year ago.
Thanks, Taylor.
Yep.
Great. I'm Brian Borg. I'm happy to be on the panel again today, and been practicing dentistry for 14 years and started in 3 dental practices all from scratch, along with working with the eAssist team here.
Thanks, Brian.
I'm Warren Willis. I'm also a practicing dentist, been practicing for 18 years. I've started 11 dental practices and excited to be here today with you.
I know you've helped a lot of dentists start practices too. A lot of younger dentists do turnkey deals. You're very talented, Warren. We're glad to have you on the team. Dr. Blair.
Yes, I'm so happy to be here. And I'm the author of many books and founded Practice Booster, our online coding and admin resource. And I'm a Chapel Hill graduate of School of Dentistry.
They have a great football team out there, don't they? At
Chapel Hill. We're really rocking and
rolling. Is that what it is? We're glad to have you here, Dr. Blair. Dr. Jenkins, welcome. We're so glad to have you here.
Oh, thank you. Glad to be here. I am Dr. Jeanette Jenkins, and I am a practicing pediatric dentist for almost 16 years now. Graduated from Howard University. Happy to be here.
We're so glad you are. And you were one of eAssist's first customers 10 years ago. And your practice has grown leaps and bounds over the years, and we're so glad to have you. You're a respected member of your community and in our community as well. Thanks for joining us. Who are we? eAssist, we're nation's #1 dental billing service provider. We have over 800 team members strong, serving thousands of dentists around the country. There's a list of some of our awards. We just won another one from the Financial Times 2 days ago. Our core purpose is to deliver peace of mind. That's what we're doing here today. We hope that when we're done, you feel better about what you're doing now going forward, treating patients with emergencies and preparing to open your practice in the future if you can, sooner for some of us than others. But remember that we're dentists helping dentists, and we have some information here that, Taylor, what's this legal stuff we have here?
I'll take it. This falls to me as the resident lawyer, but while we're really excited to share with you the information we've learned and what our dentists on the panel are actually doing, of course, we're not giving legal or tax advice. Of course, we encourage you. We're not covering every detail. And of course, we encourage you to consult with your own professional advisors to confirm information and do what's right in your particular situation.
Thanks, Taylor. So we understand here that, Taylor, use your best judgment. You added this, appears.
Right.
Okay.
Right. We go ahead, James.
Okay, we'll move on. Brian, let's do the poll here. What do you got here?
Okay, so along with all these webinars, one of the things that have really been beneficial for us, we have how many we have on here? We have usually about 1,000 dentists on, so it gives us a lot of information to take a poll. And the first poll we're going to start out with is, what is your current understanding for the state mandates or recommendations for practicing dentistry in your state? So you're going to see it pop up on your screen, and this gives us an idea of where you're at in your understanding of what you can and can't do in dentistry. So if you wouldn't mind, take that poll, and that gives us all a little bit of information.
I see the votes coming in now. They're coming in fast now. You see that, guys? It's zipping in 88 miles per hour, maybe. It's coming in.
You can see them.
It's in a minute. We'll share the poll in a minute. We've got about 70% of the people voted. We hope you all vote. Just click the button and see. It's running about 50-50 here. All right. Well, it looks like we'll wait 5 more seconds, and then we'll close it off, Sarah.
Yep, we've got about 612 of our 808 folks on the line. So if you haven't taken that poll yet, go ahead and drop in a vote real quick. And
They're still coming in. They're still voting. Okay.
Yep. All right, we're going to give it just a few seconds here. We've got 80% of you guys voting. All right, we're going to go ahead and end that poll, and we will share the results with you guys right now on your screen.
So yeah, you're right. Mostly 50-50. You're seeing that almost 100% fall under the category. There is some restrictions and some guidelines there for us, and they're either emergency dental care only or urgent and emergency dental care only. And one of the big purposes is for us today is to define what urgent care is, what emergency care is, and how that falls into each of your individual states and where you're at. But it does look like most of you are practicing. So that's good, and it just depends on whether it's under emergency or urgent care.
And 4% of so 24 dentists on the call are actually doing hygiene again, it appears.
Right. Yeah. Great.
Okay, Taylor, tell us about really the legalese, I don't want to call it a minefield, but who has the legal authority really to tell dentists what they can and cannot do, and how does this all work with the ADA and the governments and the states and the federal government and everything else?
Sure. Yeah, and so if I'm in a particular state and I'm a dentist and I want to understand, hey, what am I allowed to do? What am I not allowed to do? You want to start with your governor's executive order, the stay-at-home order, or shelter-in-place, right, that we're commonly calling them. That's going to be binding, as well as you want to look at your public health department and see if they've given a directive or an order that's binding. Now, also, understandably, you want to, chiming in this time is the state dental associations, state dental boards, or similar organizations. ADA, of course, CDC recommendations. The challenge becomes understanding, okay, what's binding, what's not. And what we actually found as we looked through this, and I've actually been through every single state. I've looked as well as at the ADA's research, the great resource.
Wait a minute, Taylor. I know attorneys are very expensive. You're like $1,000 an hour. So you've gone through every single state as an attorney.
You'll be getting this bill later.
Counsel. Good thing you're in-house counsel.
I give you a discount.
State by state.
You're right. I'm worth every penny.
Every penny. So we're giving free legal advice. Well, we're not, but we've actually done the research here, and you found some information. Tell us more about what you've discovered, Taylor.
Here's what I've found as in-house counsel for eAssist, as we're trying to be helpful and provide links and information, is that many times a stay-at-home order will specifically exclude essential businesses. Healthcare providers, including dentists, are often included on that list. And then that's the end of it from the governor. Not always, but it can be. But then what happens is your state dental association will quickly chime in and say, hey, we even though we may not be able to, require you to close, we strongly encourage you to follow ADA and CDC recommendations. In other words, only urgent or emergency care. Now, I want to be very clear. We're not saying ignore the ADA or CDC at all, and that relates to an earlier slide about using your best judgment. Of course not. Be familiar with that and understand it. But that's a different question than whether you legally have to follow that guidance, right? Whether you can actually operate or not, and what your restrictions are. Some states, even if they're allowing you to operate, in other words, if you're an essential business, of course, they may have additional requirements, to mitigate risk here, and to help with safety conditions. Utah's an example. They just lifted the ban on even elective care, but they provided some guidance. Hey, here's some PPE, guidelines, and we want you to practice, of course, social distancing and things like that. So those things don't go away, and we'll hear more of it. You also want to make sure that whatever you're doing is covered under your malpractice insurance right now.
Yeah, it's important. Well, so this map, Taylor, tell us more about what you discovered here. This looked a lot different 2 days ago. Utah was yellow 2 days ago. And you just mentioned that the ban was lifted and an executive order was released. But tell us more about what this is.
Yeah, so again, we've looked at every state, and one of the challenges in this is that states are defining it differently, and their stay-at-home orders are worded differently. And sometimes it looks like a dental board may actually have authority, to bind dentists, but in other states they admittedly don't. So in analyzing all the data and where things currently stand, we've put together this resource. It's on our website. We're going to be continually updating it. But basically, the states in green, from the information we have currently, there's not an actual dental mandate. You're allowed to operate as an essential business as defined under the governor's order. Now, again, state dental associations are understandably going to chime in and often strongly encourage complying with ADA and CDC recommendations, but this map is intended to capture what the actual legal restrictions may be. So you see that the bulk of states under current information fall under level 2, the yellow, which permits urgent and emergency dental care. Again, definitions per state will vary, but in analyzing, really what they're saying, that's why we categorized them this way. Our webpage also has links to all the sources, so you can go and look at the actual documents and see what your dental association is saying as well.
So the actual link is right here, ESIS map for state mandates, and we're going to email it out to you. It's not live on the front page. You can't get to it. You can only use this link right now. But I think by the 27th, we're working hard. We'll have it all live so that anyone can access it, even without the link. So those of you that are on this webinar, you can actually see it. You can see why we're making these decisions and why our legal counsel is saying that the states actually say by law that these are the ones that are in the various things. Now, this is changing every day. So we will update this every day. And 2 days ago, this looked a lot different than it does today. And maybe tomorrow, it will look different too. Some might pull back and not be green. And so this is changing. Stay on top of it. We're trying to help and do the best we possibly can. Any other comments about that?
Yeah, unless governors change their orders, and they have, and they can certainly extend, and they have in the past, there are many orders that are restricting dentistry and other businesses that are set to lapse within the next 1 to 2 weeks, to your point, James. And I think another important message here is nowhere have we found that dentists are prohibited from practicing at all. There's no red.
Yeah, okay, that's what we're doing. So the ADA released this statement on the 31st. They made it very, very clear that this is a changing dynamic here. And the guidance that was given 2 weeks ago, 3 weeks ago, may not fit today. And the bottom line is they're reminding us that we should use our professional judgment in determining a patient's need for urgent and emergency care. The CDC gave us some guidelines too, making it very clear that dental facilities should postpone elective procedures, surgeries, and non-urgent dental visits and prioritize urgent and emergency care visits. This isn't legally binding. That's why we went through this whole understanding of what the states are the ones that decide what's legal and what's not. This is the guidance, and the ADA is following the guidance of the CDC. And recently they released this flow chart, and I think you're using this, Brian, in your practice every day. Is that right?
I don't see a patient without going through that flow chart exactly.
I'm not making fun of it. It's a lot of good work here. I read it. Basically, if you're in pain, if it's a 6 or above, then you can be treated. Is that what it's, Brian? Is that your understanding?
I've learned now that if I'm ever in pain and I need to be treated, it's always a 6 or above.
I remember, yeah, and there's a quote in Ghostbusters. If someone asks if you're a god, you say yes. Is what someone.
That's right.
James, I will just quickly add, it's a minority of states from what I'm seeing, but there's at least one, maybe a couple that have actually the governor's actually incorporated into their order, their binding executive order, the CDC recommendations.
Great.
Again, that's a minority from what I'm seeing.
So the emphasis here is that this is changing, and so the ADA is giving us more and more guidance, and so you have it there, and this is the most recent guidance that we have so far. Warren, would you tell us what the ADA is defining a dental emergency here?
Yeah, so basically they're saying a dental emergency is a potentially life-threatening condition that requires immediate treatment. And they say, those things are like uncontrolled bleeding, cellulitis with intraoral or extraoral swelling, trauma that involves facial bones that might compromise the patient's airway. Those are a dental emergency. Now, when we talk about urgent dental care, that's much more broader, and that allows for a lot more treatment. So you're talking about severe dental pain from an inflamed tooth, pericornitis from third molars, abscess teeth, even gross caries would fall under this, fractured teeth, avulsed teeth. There's a number of, even we've got a list here that you can look at, but number of more some others are removing sutures, denture adjustments, replacing temporary filling on access teeth, and even helping our orthodontic friends out by clipping wires.
Brian, I know you're treating people, Brian, in your practice with emergencies, and if they have pain, you're treating them. If the tooth is sensitive, you're treating them. That's what you're considering an urgent dental care need. I know in Utah now it's been lifted 100%, but tell us more about your philosophy there.
Well, correct. I mean, when you read the CDC guidelines, it is a little broad. It talks about urgent. It talks about emergency. Anything that we've been treating anything with pain, and we even look at adjacent teeth and things like that. That has to be an individual decision. But if they're in pain, I want my patients treated. We've been, like it says here on the slide, we've been helping out our orthodontic friends even. I've had a couple cases where the orthodontist put the band in and it's rubbing on their tissue wrong. They would usually go to the orthodontist, but they're closed. But we're helping anybody out that's in pain. But moving on, it looks like we're going to take another poll. And this poll is a little bit more for us, and it was a little bit answered in our last poll, but we'd like to still take it. And that is, it's given the state mandates and recommendations for your practicing dentistry. This is more individual, meaning the last poll was kind of where you feel like the state is mandating, but we want to know if you personally are open in your practice. So Sarah, will you pop up that poll?
Absolutely. I've got that poll going live right now. You guys will see that come up on your screen. And now we've got about 935 eligible poll participants on the call with us.
Keeps adding up. That's great. So you'll see there the choice is no, I've closed my office. No, my office is closed because I'm at higher risk for contracting COVID-19. We kind of put that in there because we want to be sensitive to those that are more in a high risk. Perhaps they're a little older dentists or they have health conditions and they want to stay closed. And we wanted to know, if there were people on board listening that were falling into that category. I'm currently closed, but planning to open in the next 2 weeks. Yes, I'm open for emergency care only. Yes, I am open for emergency and urgent care only. And yes, I am open for emergency care, hygiene, and all other. I think we found that there are some that are there at this point.
This is helpful. And while these polls come in, I'll just say, if your office is closed and you've laid off your staff, it's harder to see emergencies. I get it. And our recommendation is you bring them back in, get the PPP, furlough them instead of letting them go so you can be open. And that's the rest of this webinar is going to talk about making the case for why we should be open and how we should treat patients and the best way we can survive and thrive during this crisis in preparation for opening again. Why don't you go ahead and close the poll?
Perfect. We'll end that poll right now and share those results on your screen.
Great. So it looks like 14% have actually closed their offices, 100%. And we've got a good number, 60% that are actually open. and another 12 that are planning on opening up right away in the next couple of weeks. Good, helpful information, right, team?
Yep.
All right, we hope that what we share with you now will help all of you. I think we will. There's only 1% that are actually open, 8 of us that are open doing cleanings again. So this is how we're surviving and thriving. Now, Warren, you just told me yesterday, or you just told me a few minutes ago that your office yesterday, or last month, it did $100,000 in emergency care root canals?
Yeah, that's this month. We have one office that between urgent care and emergency care has produced about $100,000. So
Yeah.
there's a lot of treatment that can be done if within those parameters.
It can be done, and it should be done for a number of reasons. And I think, first of all, we're making the case that it's our duty to take care of our patients. We're providers, and even legally, our PPO contracts require us to see patients for an emergency within 48 hours. We don't want to abandon them. We want to keep patients out of the emergency room. We want to make sure that people know that dentistry is essential. I got an email from the UDA recently that said, cleanings are non-essential or non-essential, and talked about that. And my response back was, do you mean
Non-elective?
Non-elective? Because that's a big difference. Non-essential and non-elective or elective is a big difference than non-essential. I think we all believe that cleanings are essential to our health. And so we want to make sure we're sharing a message here in the future that it is. And
James, let me emphasize that point a little bit, because I actually have had two good friends that have teased me a little bit over this break, that have said, oh, well, now I know that I don't really need to come in get my cleaning every 6 months. It's a money grab. And I think that this is a little bit of an unintended consequence of the shutdown, and with that the ADA is kind of shuts down, and it's all been appropriate, but it's been one of the things that we're going to have to deal with now, right? And that's to broadcast that message that dentistry is essential, and it's something we've got to do. We got to start over with this whole game with that.
I'll announce this now. We're going to do a national campaign. We started a nonprofit foundation to promote dental health, and we'll be sharing billboards all over the nation, telling people dental cleanings are essential to your health. Go visit your dentist today. We're going to hit that really, really hard for the next however long we need to ensure we combat what's kind of happened here. We'll help you do it as a public service to you and your patients. So also, while you're taking care of patients, you won't lose patients to other practices that are actually seeing their patients. Dr. Jenkins, I know you're seeing new patients that are trying to find other dentists because they have a tooth that hurts and no one's answering. Are you building your practice during this time, treating emergencies?
We have seen a number of new patients that have been emergencies, and a lot of patients who we haven't seen in years. I initially did a hard shutdown for my office, and I had my office manager there answering the phones, and then the number of emergency calls that we started getting with not knowing when we could open. I mean, the antibiotics just weren't going to be enough. So we just started doing teledentistry and bringing kids in to be treated.
And we're going to talk more about that in a minute, but you're open on Monday, Wednesdays, and Fridays doing emergencies. Is that right?
I don't have specific days because I also, I had a pretty robust surgery list as well, OR list as well. And we started calling people and making sure that their child wasn't in pain. And then it just seemed like all of a sudden, once we got to maybe that 3-4 week mark, I mean, people even on our OR list started calling. So I had to start making appointments to go to a surgery center to see patients as well.
My point is that you can thrive here, and you won't lose patients to the other dentist that's actually seeing emergencies, and people need dental care now as much as ever. You also will be able to make a living too, and help your communities in that way. I saw this movie a long time ago. It had something about a baseball diamond, and if you build it, they will come. It always pulls at the entrepreneur heart inside all of us as dental practitioners, and we believe if we just kind of modify that, if you open, they will come, the patients will come. Dr. Jenkins, there's a testimonial here by one of your patients. Can you tell us a little bit about the story?
Absolutely. So one of my patients, she just didn't know what to do. She had called a couple other places, And this was a new patient, and her child's mouth was swollen. She was crying. She was keeping her up all night. And we were able to, triage her again over the phone and with the teledentistry, and then bring her in to get her out of pain and to treat her. And her mother was just so grateful that we were there to see her baby. And I was glad too.
Thank you, Doctor. Some of the things that we've been doing here, you can read it. Now, most of you have been open for emergencies. It's the 14% of you that we're doing this for. And so we're going to skip through this quicker. But you can see, of course, if you're in pain, root canals, a lot of them, extractions, surgery centers for pedo, and you have gross caries, you're taking care of all of it. Even Warren, you're even doing immediate placement of implants to keep the bone height, crystal height intact.
Yeah.
Is that right?
That's right.
For urgent care treatments. And you're using your professional judgment for that. You can read more of what we're doing here. Most of you are on this call are still doing that. And we hope that those that aren't today will open up and start. Make sure your patients know you're open. Dentistry is essential and it's safe. It always has been safe since 1988. Is that when we started wearing gloves? I sure am glad. Dr. Blair, did you wear gloves when you were practicing as a young dentist?
No, sir.
What? Oh, that is disgusting.
And I rarely put the gloves on. In dental school, we put the gloves on for oral surgery, but that was about it.
See, we know what we're doing now. We're safe and stuff.
Back in my day, yeah.
No, in your community, like in Utah and Wyoming, where we don't have subways and everyone drives a car around, we have 25 unfortunate COVID-related deaths. Only 25, and about 2,000 people are sick. And so in some communities, you could even use humor. Like, I noticed no one was hoarding any floss during this crisis in some of your advertising, just so people could see. Who knows? But emphasizing that we're an infectious
on the shelves.
Yeah, that's right. Making sure people know that we deal with infectious disease all the time, and that should be a big part of your advertising now. Modifying your Google AdWords for emergency dental care, making sure people know that you're here for that. Even there's something that maybe some of you don't know about, but it's called blip billboards. Check it out. They're so inexpensive. I used billboards before. They're so expensive. You have to pay a contract for a year or two, and it's $2,000 a month sometimes. These blip guys, you can spend $10, maybe $20 a month. Like, you can set the budget, or $10 a day, or $20 a day, or $100 a day. You can decide how much you want to spend, and you'll get so many impressions, all these digital billboards all over the nation. It might be something to check out to help with your emergency dental care needs, getting the word out that you're still open. And then, of course, updating your web page to show that you're doing emergencies. It'll help your SEO. The more you change that. Brian, you did that recently.
Yep. Added a banner and added some badges and added some information about what we're doing specifically with the emergencies.
We're going to talk about badges too and how that can help you. But let's open it up to some Q&A right now. Take us away, Brian.
Yeah, so we're breaking this up into the different sections. So we're going to have Sarah, she's going to read off some questions, but hopefully they're specific towards the CDC guidelines, to the ADA guidelines, to our malpractice insurance guidelines, and basically the guidelines that we have and set that we can be open and be practicing safely and legally. So Sarah, if you've collected some of those questions for us, why don't you shoot it out to the panel, and we're going to see what we can do to answer them.
We're going to be talking about PPP here in just a minute. Okay,
we do have a lot of questions coming in about PPE, and so we'll cover that in a later section just so everyone knows. But a couple of questions for things that we have covered so far. In some states, there are city or county ordinances, and we're getting a couple questions from people about how that plays into the, well, of course, the map that we've put together, but also how that plays into state mandates. Which one do they listen to?
No, that's a great point. From what I've seen, and I think Nebraska is an example, the state has allowed counties and local governments to be more restrictive if they want to. Again, not every county and city is being impacted the same. So you do want to look at that in your particular state. May not be an issue everywhere, but it is in some states.
Yeah, I might chime in there. I have practices that are not all in one state. They're throughout the country, and in one state we haven't been able to do hardly any dentistry compared to another state. And so obviously I feel sympathetic for those that are in that same situation, practicing in states where maybe it's been more restrictive, but we want to help those that can do dentistry in see more that we can accomplish.
And Taylor, is it a little bit even county to county, not only state to state?
Right, it can be. In some places it is.
Like I think in Utah, I think Davis County had a stay-at-home order, but Utah County didn't. Davis County did, and so even though yesterday the state said that we could do hygiene and be an essential part of people's lives once again, there might be a county order that would trump that. Is that's the essence of this question, Taylor?
Well, the essence, yeah. So the state, if it wants to, can trump all of the counties. But what I'm reading is some governors are allowing counties, acknowledging that they're hit differently by this, to have their own, that might be a restrictive order that might be more restrictive than what the state is currently otherwise saying.
Yeah. Okay, great. What's the next question? Let's take one more and then we'll keep going.
Sure. We have another question saying that there will be a rash of phone calls to practices as they open up with patients who have a lot of questions about these laws and what the practice is doing to prevent contraction of the virus. How do you suggest they best train their team to effectively answer those questions?
That's kind of the rest of the seminar.
Yeah. We're definitely going to address some of the ways that we suggest you help your staff to take some measures that show patients you are so aware of how you're keeping your offices clean and sterile, and create that perception that patients need to feel that they're safe when they come in.
Let's move on. That's our next section here in a moment. We're going to talk about how the market has really changed, and I just got news from Marcus Stones, one of our classmates, Warren. He said Oregon has changed the rules. May 1st, it'll be green as well. So they weren't supposed to open until May 18th. So like it's changing rapidly here.
Yeah.
Hot information off the presses. Thanks, Marcus. Wasn't he ahead of you in school? I think he was number 1 in the class, and you were 5. I can't remember.
Yeah, that's right. Marcus is number 1.
So let's see. Now it's important that you open for same day. Now you got to think like a startup. Now we've started 9 dental practices. Warren, you've started 12. Brian, you started 3. It's different. It's really different than buying a practice and coming in. You have to think like an entrepreneur. You got to be open when the patients want to be there. And I tell you, your practice will survive and thrive if you are open for same day emergencies and are open on Fridays and Saturdays and weekends. You have to be. You just have to be during this time. I know in the past you didn't need to, perhaps many of you with established practices, some of you already are, but you got to right now. You really need to when you get going and when the state gives you the green light. You got to be there for patients. If they start working again, they don't want to take time off from their jobs, and so you got to be there when they're not working. Put your team to work. Make sure all calls get answered in the first ring. So many offices, it drives me crazy when you call, and for some reason in dentistry, it's okay to let the phone go to the voicemail, and it says, if we don't answer, we must be busy with another patient. Please leave a message. We'll get back to you. What that communicates is we're too busy for you. We don't have the spirit of service in our hearts. We don't really care. We're busy on the phone, or maybe we're on Facebook. I don't know. So make sure you answer phone on the first ring. There are tools like Grasshopper, Weave, and Ruby Receptionist. You can look into those things and learn more. It'll actually forward your phones to your cell phone, make it look like you're actually at your office. But just think like a startup. Have a skeleton crew. With a PPP, you don't have to send people home. You can leave them all there, and for the next 8 weeks, and the government will pay for that and have those loans forgiven. We'll talk more about that in a moment. And then, of course, use teledentistry. Dr. Jenkins will go into great detail about how she's using teledentistry and describe some more specific information. But a quick update on the PPP loan and the EIDL loans, the SBA loans that came out. It's supposed to pass today in the House. I don't think it has yet. I haven't seen it come in yet, but I've been busy with preparing for this. It should pass today, another 310. But one of our lenders that we work with closely thinks it'll be gone in 2 days. I don't think that. I think it's more like 10, but it'll be gone. So the advice that you received from others perhaps that said, hey, wait until June, wait before you open, before you apply for it. Well, it's going to be gone, and this is the last tranche at it, they said. When this is gone, it's gone. So go get it, go apply for it. Learn more about the CARES Act. We're going to skip over this slide, but there are things you can do you can watch our previous webinars. You can see our stuff on our webpage, and you can go to Adam Schiff and the Academy of Dental CPAs and the ADA. There's a lot of information about the CARES Act. Most of you know about it already. But let's talk about increasing your profitability during this time too. Warren, I know you're an expert at this. You have overhead of like 30%.
Maybe not quite 30%, but we do, at all my practices, we have under 50% overhead. It's something that's near and dear to my heart. We have some that are close to 40% in overhead. And it's something that we're excited to share with you in our next webinar about how do you protect those margins. The easiest way to create profits for yourself is by lowering your expenses. And some of these ideas are listed here in this crisis, like you could lock your credit cards so that you can kind of see what your true statements are for companies, stop auto payments.
And we appreciate you. Thank you for doing this. Now, one of the things Dr. Borg talked about is we really have to combat the idea that dentistry isn't essential. Another thing is that dentistry is dirty, that it's not safe to go in and have the drill and all the aerosol everywhere. We really have to combat that. So you've got to be thinking about things, and here are a bunch of ideas we've gathered from others and our own, some of our own thoughts and things that we're doing too. And you can see, Brian, why don't you talk about this here a little bit?
So these are some precautions, and Dr. Blair alluded to this earlier, that these are some things that you can have conversations with your own staff, have a staff meeting, come up with your own plan. We have a lot of tools that will help with this. Taylor's put together a 35 test question that he'll go over, but there's lots of things that you can do. But again, perception is reality with this. You want your patients to perceive that you are doing all that you can do to combat the cleanliness issue here. One is that we're going to have, and some of these are actually coming from CDC, some of these are coming from individuals, but chairs 6 feet apart. No one is waiting and gathering in waiting rooms. I know that some offices, what they're doing is they're having them wait in their cars. One thing that in my practice, we have a lot of families that come in. And sometimes when those families come in, the mom brings about 6 kids and only 2 of them get seen. So one thing that we talked about is that we're only trying to bring those that we're seeing into the office at this point. If you're not being seen, you're going to have to make arrangements not to bring them into the office. Patients see the staff wiping countertops down, sterilizing door handles, phone, computer pins. Again, if the more you do it, the more the patients see it, the more they'll trust you. And of course, it works. Staff have a spirit of service. They're cleaning and organizing. Screen for illnesses. One thing that we're doing is that we have a no contact temperature device. Anytime
isn't that from your pizza oven that you have in your backpack?
I have a medical grade one, but I have a backup that I use for my pizza. It works the same.
It works the same.
So the bottom line with that is they are very hard to get, James. I know that I've been looking. I had this previous to the whole disaster, but they're hard to get. So if you're having a hard time getting it, use what you can use for now.
You go. Now, I'm going to interrupt you here. Dr. Jenkins, I know that you are giving gloves to your patients. Is that right? How's that working out? How's that received?
Oh, she's muted.
Dr. Jenkins?
Dr. Jenkins, you're muted.
Oh.
There you go.
There you go.
Okay, sorry. Most of them come in with masks already.
Yeah.
And for them to wash their hands, they have to come all the way into the treatment area. So we give them gloves at the door. And we've only been having one family in the whole office at a time right now. So we're taking all the precautions that we can to make sure that everybody, me and the staff and families, stay safe.
That's good. And how's it received when you give them the gloves? Are they like, what's this for? Or do they just, oh, thank you?
Oh, no, they're grateful. They're like, oh, thank you. Yeah. Like I said, they usually come with masks on, which I've been impressed with.
And you meet them at the door.
We have those ready to give.
Do you open the door for them? Like a 5-star hotel? I love it. We do,
because we lock it. We don't want anybody else coming in.
We'll lock it. Well, I love it. Whenever I go to if I've ever been at a 5-star and they've opened the door for you, they give you a bottle of water. They don't ask if I want to wear gloves, but maybe they will in the future. But I love it.
There hasn't been very many good things that have come out of the crisis, except all the solicitors that come into our offices. They're not coming by anymore.
They're not coming by. Okay, we're not going to spend any more time on this, but you can see this. One of the important things is having masks worn, and then some states are saying plexiglass barriers, others are saying face masks. We'll talk more about that. But this came from the UDA, and every state's going to be a little bit different. But it said that it was in the UDA or the state public health guideline that gowns or shoe coverings in Utah are not necessary. You may feel differently and use your best judgment. And so these guidelines are up in the air until OSHA comes out with concrete rules like they did in 1988. It really is. Use your best judgment. Do what you feel is right to slow the spread in your communities.
Unless as your as your governor opens things back up, they may very well provide some requirements as you do open up, and that happened a little bit in Utah. Not all those things, but some of them were on that executive order.
Yeah, good point. All right. Well, the Gordon Christensen for the last 3 years, Warren, you've read this. It was $25. Recommend everyone download. Tell us more about what you learned here.
Yeah, basically he's got some various air filter purifying machines, and they recommend that these can even be more valuable than wearing masks in the research that they've done. And there's a link there to the research, but they're basically more expensive according to how effective they are. But they might be a great addition that you could put in your office. Patients could be aware of them. You could even point them out. Like we said before, it's all part of the perception of how much you are doing to keep a sterile environment in your office.
It's a big deal. I'd advertise. I'd tell the whole world that I have those things installed.
Yeah.
Make sure they all know.
Yeah, they're expensive. You'd want to advertise them.
Yeah, there's an article about 5 years ago in the Harvard Business Review that actually talked about the smell of peppermint, and it was a double-blind study, and it was proven that it did something to make them. I think it was peer-reviewed. I don't recall the details, but it calmed patients down. Like there was something about peppermint that subconsciously made people calmer, and it's part of the problem we're dealing with is the fear of coming into a dirty environment and seeing a dentist anyway. And then of course, checking your for all of our assistants, I think we want to put face shields on. We haven't been doing it now, but I went to Chick-fil-A and they're doing it. They have these face shields. We'll go to it here. And I think the UDA said, or the state of Utah said we can do it. We can open and do essential dentistry as long as we use face shields, including the people in the front desk, or have a barrier, plexiglass barrier, like you're seeing at some of the shows or restaurants. I don't know how long this will go on. I'm not sure I want to put a plexiglass thing and put holes in my walls and my cabinet. This seems to be more professional medical grade type stuff, and people will know you're taking stuff seriously. These are ideas. Your state will have different rules. There's different types of masks. N95 masks are used more for construction. KN95 masks are softer. And you can see what they look like. You can still buy these now. The ADA is suggesting these. I think I got this link from DC Dental Supply.
Dental.
Yeah, DC Dental just yesterday. Very expensive, like $50 for 10. And one of our ladies was suggesting that, one of the doctors suggesting that you actually wear 2 masks. Warren, what did she say?
Yeah, she said you could wear your expensive mask underneath and use a cheaper mask on top, and that way you wouldn't touch your expensive mask with your hands. Or rub your nose or something, and that way you could get more use out of it. And I've heard of others spraying masks with 0.5% hydrogen peroxide to keep them sterile and clean as well.
We do. There's some other things that our biological dentistry friends for years, holistic dentistry friends for years, have been using these mercury vapor vacuums. And I have a handful of them. We'll pull them out of storage and we'll turn them back on. And it really does suck up all the aerosol around, and it's supposed to suck up any mercury any vapor or whatever. That's what they're designed for. But it really, and maybe there's truth to that, maybe there's not. I don't want to say, but I do. There is a vacuum here that you could use, and they're already for sale, and you can buy them, and they're inexpensive. And that's another thing you could do if you wanted to set your office apart, to show people that you take this seriously, that it's safe to come here, and to make it safe too. There's also this device from Spain. Warren, tell me more about this you found for hygienists.
Yeah, so this is a device that it is manufactured in Spain. We haven't been able to locate yet a U.S. distributor of it, but it's basically an autoclavable cheek retractor, as you can tell, that fits onto your HVE. And at the very bottom of it, just in front of the lower teeth, it sucks the air out right there to just kind of would also be utilizing the same purpose of where you're removing the air from the patient's mouth.
Well, we appreciate that. Now, thanks, Warren. We're ready to move on to the next section. We're getting to teledentistry here in just a minute and do some Q&A. But one of the things that we're offering to combat what Brian said, people are concerned about, you've got patients coming in, they got to know that you're taking things seriously. And so we've developed a certification to certify that your office is COVID-19 clean. Taylor, you're our attorney, so take it away. Tell us more about what you've learned, what this is, how the test works.
Absolutely. So we're offering the opportunity. It'll come out eventually, and there'll be a link for it. Not
No
quite
charge.
ready.
It's totally free for anybody. Doesn't matter if you're ESIS customer or not. Totally free.
Thank you. Right. Trying to be helpful to dentists across the nation. COVID-19 cleanliness certification. So what we did, reviewing ADA, CDC, other third-party sources, we put together a list of things that would make sense for you to do to greatly reduce the risk of any COVID-19 issues in your dental office. And I put together an initial list, and several of the dentists on the panel, they just ripped it apart and helped me improve it. And, so it's been vetted and it's practical, but it's also based on, the information that we have. So the idea is if you pass the test, you're going to be able to not only feel good about what you're doing in your office, but also broadcast it, publicize it, bring peace of mind to your patients and the public. You'll be able to pick any of these and print off a poster, turn it into a sticker, let people know that it's safe to come to your office.
Yeah, pick whatever logo you want. We have more of them too. Some will have the ESIS logo on it. Some won't. Doesn't matter. We hope you use it to show people that you really do care about their health. And then we have a certificate you could laminate and put it next to your questions when they walk in to know that the office has passed certification and it's clean. And however you want to use this as a tool to help your patients have peace of mind. That's what we're trying to accomplish here. Yeah.
Before you move on that, one thing that we did in our office, I took those 35 questions in and we had a staff meeting, a staff lunch. And it was a great talking point. We went through with all my staff, my front office, my hygienist, my assistants, and we went through those questions one by one. And it was a great exercise. It's something you can do with a staff meeting just to get everybody up to date. And it kept an order to the meeting, and we had a great conversation just because of those questions.
Great point. Okay, let's briefly talk about how the HIPAA laws have been relaxed. Most of you are aware of that. You can now use your phone to do teledentistry for a season. And Taylor, in 3 seconds here, just 5 seconds, tell us a little bit more about some of these ideas here.
Yeah, so the government's relaxed enforcement for teledentistry or telehealth. So we're talking about teledentistry, of course, here. And during the crisis, you have to act in good faith. There's really four, and again, you'll be able to get these slides, but 4 really important reminders, okay, as you do this though, and as you use it. Make sure that you're covered under your malpractice insurance. You might want to consider too if you want to get or increase your cyber liability insurance if you're doing a lot of this. Number 2, make sure it's permitted in your state. Just because the federal government has said, hey, we're going to ease up on the HIPAA compliance for this, it may not be permitted in states like Connecticut, Maine, Mississippi, Texas. There may be others. We're going to be providing some information there on our website. Remember that it's limited. It's relaxed with respect to teledentistry. But of course, you still have to act in good faith. Don't sell the PHI or anything. And don't assume that HIPAA is relaxed with respect to things outside of teledentistry. And then remember, really importantly, this won't last forever. So if you really like teledentistry and you get going, don't get caught with a product that doesn't comply with HIPAA after things get back to normal. So plan ahead for that. And I think it's going to become more and more the norm. And a bunch of states, including Utah, have been working on laws or even recently passed them to make teledentistry more of an option for dentists.
We're gonna talk about in a minute. Dr. Blair will talk about coding it and how you get paid for it. But Dr. Jenkins, you've used this very, very well in your practice. And would you mind sharing your experience here? Just tell me when you want me to advance the slides.
Okay, certainly. Actually, is there a slide over after this that has the paperwork information on it? Okay, well, I'll start with that one. So if you look at this, we get the calls into the office. And if you look at this picture that's on the right of the screen, we send a link to our patients. So let me back up real quick. One of the great things about what Dr. Anderson has done here is, it's really good to be able to talk amongst colleagues and get information because you just don't know everything by yourself. So kudos, Dr. Anderson, again. So I was made aware of how to do the teledentistry from a colleague, a girlfriend of mine, and she gave me an app that we could use. So you send the link. Once the patient calls, you send the link to the patient, and you have forms on there that you can customize what you want the patient to fill out. First thing first is the permission that we can do the teledentistry call. So there's actually more pages to this, but I just put on the first page. And then if you could go back to the next slide, the previous slide. So we also send them, in that form, it asks if they were a member of the practice or not. We, of course, want to verify the medical history. So if we need to send them out a new one, fine. If we need to get an update, we do that. And then we ask them to take some pictures. And you'll be surprised, the parents are actually pretty good at it. So these are the pictures that one parent sent to us. And these are the x-rays that we have. So my office manager is able to remote into the office software, she and I both. And so she starts off with the patients, she gets all the relevant information, and then she contacts me, she gives me all of the information so that I can take a look at it, and then we have the call with the parent and we discuss what's going on with the child. And sometimes if we need to give an antibiotic or a referral, I've had a lot of people who just really had canker sores, and it was easy to see, and you didn't have to bring them into the office to, take a lot of time trying to figure out what was wrong. So these are some of the things, again, the pictures that we were sent, and, you all are dentists, you can see some of the things that are wrong here. And it shows the treatment plan. Now, she, of course, sends me the notes also. If they're an existing patient, I need to know what has happened in the past. So I get all of the information that I can get, and then we use this to triage so that we can book an appointment a day and bring everybody in and bring a number of people in at one time.
Well, thank you, Dr. Jenkins. We're super impressed with you and your practice, and we've seen it's just top tier, top 1% of the nation, just fantastic dental practice and great insights. Thank you so much. We're just going to be really simple here. What apps can you use? You can read them there. You can't use stuff like TikTok that the Chinese get, and Facebook Live and Twitch, those things, public chat rooms. You can't do that stuff. But we're also releasing a free, what's that, Taylor?
Real quick, Dr. Jenkins, what app are you using?
I'm using Opera DDS.
Okay.
Yeah. So we're releasing a free eAssist Teledentistry app. It'll be free for everybody. It'll be free forever. It'll be HIPAA compliant. It'll be released here in the next little while here. And so, it's available to anyone. You don't have to be an eAssist customer. It's just a way for us to promote dentistry. And so you can still bill for a limited exam and take care of patients and keep your schedule full and take care of the needs of the patients without bringing them in and treating them for a canker sore, right? Like what Dr. Jenkins mentioned. So Dr. Blair, would you please tell us more about how to code? It really is pretty simple. Let's bust this myth. It's not hard. How do you code for it?
I'll kind of reduce it. The ADA does have the various codes, the various scenarios, all that type of thing. So I'm going to kind of reduce it to just a couple of slides, a couple of codes. But basically, the teledentistry code that you'll use is 9995. I do want to emphasize that this is not legal in some of the states, and we had a previous slide here. But if it is okay in your state, then what we mean by teledentistry is where I actually file a claim. It's got the 9995 teledentistry code on it. Probably the best code from a reimbursement, from a level, is going to be the emergency exam code, the problem post exam code 0140. Some of the insurance carriers, payers now, the normal coverage with the typical policy is 2 evaluations a year, no matter what type of exam it is. But some are also bringing out an extra couple of codes. So go to the ADA website. It has a list of various payers. Keep up in that respect. One other thing that's very important. If you notice Dr. Jenkins there, and boy, she's really got her act together. But code 140, the ADA says, is that if you're doing teledentistry, there's an audio component, but there must be a visual component. So if the patient could transmit a picture, but if you do have the video, you are interacting, you have audio and video, then you have complied on code 140. The other thing is that the teledentistry code is not being paid very well. At this point, that may change a little better. The fee for that is fairly low, somewhere in the $12 to $15 fee. Your emergency exam is more along the lines of $100 or so. So it's not illegal to have two different fees for the same code under, different circumstances.
So that's an important part. Let me emphasize that. So what you're saying is, if it's not a PPO that you're working with and you don't have a specific price set for D0140, that if you're doing a teledentistry conference or you're coming in, you can have a separate fee for that same code depending on how you're doing that exam, either through the phone, Facebook, Zoom, or live in your chair. Is that what you're saying, Dr. Blair?
Well, that's correct. In other words, maybe it's one code in my office to see a patient face-to-face and do code 140. It could be a different fee, say in teledentistry. Now, keep in mind, if you are in a PPO, there's the handcuffs, there's the write-offs. But if you're out of network, it's not, it's not illegal. And we always put the full fee down anyway. Anytime you're in a PPO, never put a PPO fee on any claim. We always put the full fee that we're charging. Then we would write off when the claim comes back down to the PPO contracted fee that's on the claim.
That's a great point, because the reason why our fees stay low and they keep getting lower, I tell you, Dental Select of Utah here, back in 2003, it was $108 for a class 2 composite. It's now $106. I think it's because we're all putting down our PPO fees on the form when we're submitting our claims, so they never go higher.
That's right. That's right. That's a big mistake.
No, please.
Big mistake.
Big mistake. All right. You also have another code here too. If it's used properly, it can be used, and some people are paying this in Hawaii. I know they're paying it. Tell us briefly about this code, Dr. Blair, and how to use it correctly.
Yes, this code has come up. It's been around for 100 years, I guess. And the proper use of the code is that the office is closed. The doctor comes in, specifically opens up the office outside of normal hours and sees the patient. And that's code 9440. There is some coverage out there. As to Hawaii, Delta Dental, Hawaii Dental Services does cover this code, and they have for years, but don't abuse it. What you can't do is say, well, I'm going to be open Tuesdays and Thursdays and see emergency patients, but I'm going to charge every one of them coming in the 9440 code, and that is a mistake. If I'm seeing emergency patients, say on Tuesday and Thursday, but I make a special trip in on Wednesday or Friday to see a specific patient, open up the office, yes, code 9440 could apply.
Thank you, Dr. Blair. Now, Dr. Jenkins, I know you go into the hospital often and you do surgery days there. Are there different codes you submit there when you go to a hospital environment like that, or is it just the same as in your dental office?
Yeah, the dental codes are the same as what I would use in the dental office. There are a couple additional codes, but that is for the facility and anesthesia. Yeah. And that's typically billed out by the facility and anesthesia.
And also, too, James, going to the hospital, I could charge a hospital, going to the hospital an extra fee because I'm not doing it at the office, that type of thing. That's legit. Typically not reimbursed, but it is payable, by the patient under most payers.
Yeah, that's the hospital call fee.
Hospital
right.
That you're talking about. But a lot of insurance companies don't want to pay for that.
Yeah, they don't.
But, yeah.
Dr. Blair, we're going to wrap this up here, but there's one more code that applies to teledentistry. Can you please explain this code, D9310?
Well, the consultation code is basically we can only use that code if someone, either a dentist or a physician, refers the patient to us. And so the endodontist is an example. If the GP refers a patient over to the endodontist, they could use either the consultation code with that patient, or they could use just their standard exam codes. And some of the payers, they will check to see you have what's called a taxonomy code on every claim down there for who did the work. There's a 10-digit taxonomy code, and so the payers know it's a specialist because each recognized specialty has a special 10-digit code. So there's a code for endodontist, periodontist, and so forth.
That's wonderful. Thank you for sharing that. Dr. Blair, do you want to talk about your upcoming webinar and Practice Booster?
Yeah, I'm really looking forward to that, and it's coming up. So watch for your emails from eAssist. But we've got roughly about a 45, 50-minute webinar specifically on teledentistry. We go into all the ins and outs. It's quite interesting. It's a changing ball game. So be sure that you do tune into that. And of course, our Practice Booster online website. I've also got posted there a little blog right now open to everybody. The ADA is bringing out 2 new codes for testing for the virus. Those codes come out June 1, but be advised, you've got to get something called a waiver certificate from CLIA, a laboratory. And it's a fairly simple process, but sometimes some states require, a month of processing. And so we've got on how to do that. And really, you need to be looking into that right now because you need that certificate to legally be able to do these tests in the office. And the certificate's about $180 for 2 years, but be aware of that coming up.
And our understanding is that the insurance companies will be reimbursing dentists for that. So when patients come in and we test for COVID-19 with some rapid machine, as long as we have this approval, this bypass you're discussing, and we're going to go into more detail in another webinar about how to do that when we actually have access to those machines. Right now, we don't. But the day will come, the free market will work. Just like when I'm in New York and it rains, there's umbrellas everywhere. They come out of the woodwork. It's amazing. I love this country. What a country. Well, the same thing will happen with these COVID-19 machines. They will come out of the woodwork and anyone can do them and it'll be just standard and insurance companies are going to pay for them. That's what the ADA was able to get, from my understanding. So we'll do more about that in the future, just kind of a heads up. But let's now we're almost finished here with our content. We're just going to wrap up in a minute. We have like 2 more slides, but let's do a few more questions. And then the rest of the questions we can answer via email. Sarah?
Yep, we do have a lot of questions that have come in, about almost 90 that we've seen so far. So if we don't get to your question, we will try to follow up with you later, or you can always feel free to email us. I'll shoot you guys our email address afterwards so you can reach out to us. We got a great question here from Penny Wills. She asked, is the ADA allowing a procedure code for infection control since our disposable supplies prices have gone up and are hard to buy?
Great question.
That's a great question, and I'll go ahead and answer it. There is a lot of debate going on as to whether there would be a separate PPE fee. Back when we had the HIV come in and so forth, all the ins and outs of that. I think in terms of a long-term PPE fee, no. In terms of possibly a short-term for the next, 90 days, who knows what it's going to be, we may see a little bit of that. And we know that some of the payers, some of the deltas are considering possibly of a temporary basis the PPE fee. Now, if you're out of network, no problem. Simply raise your fees, pass that cost along to the patient. But if you're in network with the PPO, you've got the handcuffs. You've got to do it for the PPO fee. So hopefully we'll see a little bit of relaxation here. But I'll tell you, it's a changing ball game, and it's very much up in the air. That's an excellent question, but right now,
Dr. Blair, so my understanding is there already is an ADA code for that, but it's just never used because no one ever pays for it. Is that correct?
No, sir. There's not a PPE fee. I mean,
there's not an extra code for infectious control.
There is no code.
I thought there's an OSHA code.
Yeah, an OSHA. That's what I'm talking about, an OSHA code for infectious control. I remember when I was a brand new dentist, when I was back in 2003, I had my own practice. I started charging OSHA codes because I saw it in the book. I was like, I can charge that? And then I started losing patients left and right.
Yeah,
they're like, wait a minute, when I get my teeth cleaned, why do you have an OSHA code?
There is no current code. There's about 700 codes, but right now there's not a current separate CDT code for infection control.
Yeah.
James, weren't you telling them there was an extra fee if you wore gloves, if they wanted you to wear gloves or not?
Look, I was just trying to make it. I was trying to take care of patients. I was $1 million in debt. I was scared to death. My staff was mad at me, and they were telling bad stories about me. I mean, it's just a tough thing.
Kind of like a separate anesthesia fee. You know, you got this root canal, you want me to numb you up or not? It's extra $10.
I did even try to use that because there's a code for I used anesthetic, and I realized after 2 patients you can't do that either. It makes everybody mad. All right. That's a great question.
It was a good one. Another question we're seeing come up in a couple different places is, one, what kind of PPE do you need to provide to your staff? And twofold, the second part of this question is, what, if any, legal ramifications does a dentist need to consider when bringing staff back in with the exposure they could have to COVID-19?
Taylor, would you take that legal question, please?
Yeah, well, there's in our great country, which I love, of course, there's always the risk that you get sued for negligence, right? And that's part of the benefit of these things that we're talking about today. You know, be careful, understand what the recommendations are. I've even seen some propose that if you're treating, patients during this time, for example, for emergency procedures, some dentists are using like specific kind of liability waivers or consent forms tied to COVID-19. You're doing your best as a dentist, but of course you can't control what might happen in your office and what someone might, bring in. And so the same issue could occur with respect to your employees. Hopefully you have insurance, that's helpful with those issues. And then again, take steps. And states will be different. Some states are coming out with or have come out with specific requirements, especially as they relax restrictions. Others may not. Again, your dental associations will point you usually always to CDC and ADA guidelines. Some state dental associations are also producing some of their own material.
I think this harkens back to what we were saying at the beginning of the meeting, is that the UDA will, and the state, or the ADA and the local dental associations will give you guidelines if they don't have any legal authority in that state. They're guidelines. The bottom line is what their state says you must do. And from my experience, the state of Utah just released, we can open up again, but we have certain things we must do to be able to open. Like we're supposed to wear goggles, I think. And
or face mask. Yeah.
Or face mask. I know, but the goggles, supposed to wear goggles. So like you've got to look, your state's going to tell you exactly, and they're the legal authority. And you can't, you can't get sued because you didn't follow guidelines of someone who didn't have any legal authority, like us. But you can get sued if someone gets sick, an assistant does or something, and I think, if you don't follow the guidelines that the state has said you should follow if you are going to open again, right? Is that fair to say, Taylor?
Yeah, it is. I mean, on top of that, sometimes it's not always quite that simple. In general, again, you just want to, be doing things to decrease the risk that anyone has an issue, right? And there's so much material out there that, again, jump in. Our certification test can help there, and to help you avoid any kind of claim or concern there.
Well, let's wrap this up here. First of all, I want to thank our panelists, Dr. Jenkins and Dr. Blair. Thank you for coming on. It's a pleasure working with you both.
Thank you. Thanks for having me.
So glad to have you. We hope that all of you that participated recognize that we're dentists trying to help each other. And we hope that you have enough ideas to create a thoughtful action plan, and you share them with your staff tonight. Do a Zoom webinar with all of them and get them together and start talking about what you've learned here. When our test goes live, you use that, like what Dr. Bork did, to talk about things and how we're going to ensure that we're safe. Update your marketing efforts to talk about emergent care and urgent care, and that we're safe and we're clean. Use our certification and put it on your stuff so that people see that you care about COVID-19 cleanliness, and you're different than the other dentists that aren't doing that. Start using more teledentistry to fill up your schedule. It's really pretty simple and straightforward, and you can use any tools right now that are available. And then we have another webinar that's coming up. Register for our next webinar, Mind Your Margins. Go to dentalbillion.com/mindyourmargins. It'll be May 4th. Dr. Willis, who has 40%, 25% overhead.
That's
What is it? Dr. Willis will be on leading it. I got to learn from that. I got to get my overhead down. I mean, there's two ways to be more profitable.
That's
More
right.
patient or not spend as much money going out. So, that's great. Anything you want to add to this, Brian? Any comments?
No, we're good.
Well, thank you all for joining. Of course, you can get your PACE. Sarah, can you talk about the CE credit and how they get it?
Absolutely. We're going to send you a recap email after this webinar. It'll include the recording. It'll include a copy of the slides, all the information for the certification test, the link to register for the next webinar, as well as information you need for your CE credits.
thank you so much, everyone. With that, we're signing off until next time.
Thank you.
Thank
Thank
you.
you.
You know,
Bye-bye.
Bye,
see ya.
everybody.
Bye.
Bye.